Good afternoon and welcome to Appetite, the latest installment in the VisualDx Clinical Education Series. Please feel free to post questions via the Q&A area of your screen or on Twitter at VisualDx or via our Facebook page, which you can find by searching for VisualDx on Facebook. We would like to start off by welcoming Dr. Mathew Devine. He is Associate Medical Director at Highland Family Medicine and Assistant Professor in the Department of Family Medicine at the University of Rochester. He earned his degree at the Philadelphia College of Osteopathic Medicine and completed his osteopathic internship at Crozier Keystone Health System in Drexel Hill, Pennsylvania. He then completed his family medicine residency and faculty development fellowship at the University of Rochester, and one of his current focuses is on providing education to family medicine residents in the area of quality improvement and leadership. So without further ado, we'd like to welcome Dr. Devine, who will be leading our discussion today on clinical apps.
Thank you guys for having me today. This is a very pertinent topic, I think, to most 2015 practicing clinicians across the United States and abroad. And I think that this will give us an opportunity just to kind of explore this kind of wild, wild world of apps that are out there. Just to let you guys all know out there, I have no financial conflicts of interest to disclose. I am a non-paid peer reviewer for DynaMed, and this application list that we're talking about is biased just from my own clinical experience as well as a presenter and from feedback from colleagues and from other peer review articles and other lectures that I've attended myself. So without further ado, today the key learning goals are just to review the different types of apps that are out there that are available to us all, and they're in a variety of different platforms. They can be for clinical use, patient engagement, or communication use. And then I'd also like to kind of go over a little bit more about some of the examples of what are the best apps that are out there, how to determine what is a trusted app, and also how to recommend apps to patients. And hopefully throughout this you can teach me a thing or two as well. So just by way of introductions, as I mentioned before, there's many of these. Currently, this is probably even an old stat. There was 40,000 medical apps available from an article back in 2014. And as we go on, these opportunities for using these, both in the clinical realm and beyond, expand in many different directions. So depending of the type of clinical work you're doing, if you're in your own practice privately, you might use them in between patients, during patient care, after. If you are in a teaching setting, you might advise, you might learn about apps from your students or residents, and obviously the patients are ones that are also coming in with their own information now that they have this right at their fingertips as well. So this kind of slide is targeting what are the different types of apps that are out there and what kind of conditions are they being used for, and what in general that has been done for me is I've kind of broken these down into different categories. So, you know, there's apps that have medical information on them. There's a whole other category of medical devices that are out there that can help with diagnostic testing and use, and these are the ones that have FDA oversight with them because they are an actual device that has to be kind of overseen by them. Then there are some other kind of enterprise applications that often do also have some FDA oversight when they're involved with some of the other kind of pharmaceutical discussions and stuff like that. And then there are a variety of different communication portals, both via as far as patients getting in touch with their physicians, even some remote in the field from very remote areas where there's lack of medical facilities now. They're kind of even using some apps to kind of portal into emergency departments elsewhere. You can use them to locate health care, say if you're on vacation and need an urgent care or you moved patients can use these for those, as well as many different patient reminders and alerts, patient motivation. A lot of the smartphones that we carry now, this is a huge, huge growing field, and so there's many of these out there as well. And as you kind of look to the list, there's many different types of apps that are out there. The kind of biggest ones that we end up kind of looking into are medical referencing and other healthcare related kind of tools. But you name it, you can kind of plug it into your app store, and you can most likely find something out there that's on that. Now, is that trusted or not? We'll get down to that at a later time. So I've got a question about what is your favorite paid app. So my favorite paid app for me that ends up being ones that I'm using, obviously I'm unpaid for DynaMed, but I do get a prescription to DynaMed for them. So I use DynaMed mainly in my every day when I'm doing my clinical care. My institution, I'm at University of Rochester, actually doesn't have a subscription to DynaMed. It uses UpToDate, but I find that DynaMed works better for me, so that's my favorite. For the next slide, we'll talk about top app makers, and this one I think is quite telling. So again, this source is from PocketMD, and what basically is important for this slide is big pharma is involved quite considerably in the roles of pumping out these apps, and so just take that with a grain of salt. Now, these are not all medical applications or clinician-centered. They're also consumer-related applications, which in some ways is great. So if a patient is on, one pharmaceutical product, they have the opportunity to get into some consumer-related information, some consumer-related reminders, all of that type of thing. But as you can see, every major pharmaceutical company is kind of involved in this, and some more than others. As you can see at the bottom, Bayer is kind of really making up over 10% of the market there. So we kind of talked about most popular clinical apps, and I was happy to kind of share my personal favorite. There's other paid apps that I belong to. Looking kind of at my slides here, there's obviously a ton of them out there. Some caveats to paid apps is sometimes they start free, and then over a period of time they can be either upgraded or that free portion goes away, and then you do have to kind of pay in to be part of that. Prices vary significantly. They can be as cheap as 99 cents, as much as $500, depending on the app that you're choosing. Of course, different institutions may have participate in various, through their library systems or through other venues, may provide to the clinicians within their group different opportunities to be part of those, so that you might have to pay for those. But these are some of the most popular based on some recent research. Epocrates has been around for quite a while, as well as Medscape, MicroMedX, Calculate, QxMD, and then as well as some of the others as we kind of reviewed to before. And we'll get to some of these further in some of our case studies as we go on. Okay, so why don't we move on to a case-based example here to kind of put this into use. This first case, got to give credit to University of Pittsburgh, did a very nice discussion that I attended at the Society of Teachers of Family Medicine more recently, and so some of their cases that I've borrowed for them we'll be reviewing today as well. And this is VD, who is a 46-year-old male who presents today for his annual physical, and it was 1 week after he had some routine blood work done. His last physical was about 10 years ago, so he's kind of typical 40-year-old male who sometimes gets lost to care. If you look at his past medical history, he's got a history of high blood pressure, type 2 diabetes, and depression. He smokes significantly. He drinks alcohol about a drink per day, denies any illicit drug use. He is sexually active with multiple partners, and he walks for exercise to smoke a cigarette. So he doesn't really do any formal exercise. He's had no surgeries. Physical exam was unremarkable. He's on quite a bit of medication. However, he misses frequent dosing every week. So he's on metformin for his diabetes, lisinopril and lodipine for his blood pressure, tamsulosin, fluoxetine, a multivitamin, and some saw palmetto. His vital signs on exam are 138/92, and his labs show a not terrible cholesterol level. So kind of looking at this, questions I would have are, what should we do for this guy? What's coming in for a physical? What are the grade A U.S. Preventative Services Task Force recommendations for this individual? And so using a medical application through the Agency for Healthcare Research and Quality, they have an EPSS app that's quite nice at kind of taking the age of the individual, the gender, as well as if applicable, if they're pregnant, if they smoke tobacco, if they're sexually active, and then that can kind of tell you based on these updated U.S. Preventative Services Task Force recommendations what would be recommended for this individual. So kind of scrolling through with our gentleman, we've said he's 46, he's a male, yes, for tobacco, and yes, sexually active. And multiple A grades kind of come up that we can proceed to look at and review with him. We've already obviously been screened his blood pressure. We've gotten his updated cholesterol levels. We've counseled, hopefully we'll be counseling him about his tobacco use. And just kind of looking at this further, you can break these down. Aspirin is recommended in his age group because he is 45 to 79. He does come in with that diagnosis of diabetes, so he should be treating himself to prevent stroke or heart attack, and that comes in with an A grade. So these are updated all the time, and oftentimes the U.S. Preventive Task Force is what I really use to help me in providing care. When you look at other apps that are available out there, there's a plethora of calculators out there, and one of them happens to be QxMD. And QxMD, again, is a free app that you can download, and it really gives you many calculators. There's over 150 of them that you can use, and of course, this again is something that's referenced using PubMed integration, which I think again makes it trustworthy, and up to date as kind of new studies come in that change things over time. So kind of questions I had for him in particular were, what is his risk, cardiovascular risk for developing heart disease or stroke? And so Calculate by QxMD has many different calculators, and they just so happen to have the American Cardiology and American Heart Association cardiovascular risk calculator that you can kind of plug in his age, his information, and that can kind of spit out an answer to you as to how significant his risk is for potentially developing this, which then would kind of open up the next step with, since this guy is a smoker, he's a diabetic, we've seen his cholesterol levels based on his risk, should he be on further cholesterol medications. Now, fortunately for this, I'm not going to have to get into the debate regarding cholesterol screening and all that comes into cholesterol screening, so I'm going to leave that to you guys to make a decision as to whether or not he should be on that. But the next part of this is, this is a great example. I'm not sure if anybody else has a patient like Mr. VD here in their practice, but now that he's only coming to see me every 10 years, what can I do to try to help motivate him to take care of himself when he's not coming into the office to see us? So as a family medicine provider, even if he came in to see me often, on average, this is a patient that I'd probably see an hour and 15 minutes, maybe an hour and a half total over the series of the year, even if he was coming in as frequently as I'd like him to come in. So I need him to be able to make sure that he remembers to take his medications and what types of things can he do to do that. Now, there is a lot of options for having pill reminders, let alone just a simple setting your clock to a certain time every day. That's one option, but there are many others out there. And again, there are companies that probably, we prefaced on previous slides, that probably have and own some of these pill reminder apps. All right, kind of moving on to some other applications that we can use. Case 2 is RV, who's a 32-year-old female who is presenting for her OBGYN for 28 weeks of pregnancy. During her visit, she actually complains that she's been having ongoing, pretty persistent acne since she was a teenager. She has a friend who takes doxycycline and reports that it works wonders for her. She was wondering if she could take this medication, and she also has not gotten any immunization so far during her pregnancy. So this is for those that are in family medicine or OB care. You know, if you're still seeing pregnant women coming through, if you're in urgent care, obviously the questions come up quite considerably. If a person's pregnant, what kind of medications can they usually safely take? The answer usually is not many, but that being said, there are apps out there for this. So looking at Epocrates, which is like I said, been around for quite a while. This, like I said, does have a free app involved, and there is a paid prescription for that that does offer more insurance clarification as far as coverage for certain medications and et cetera like that. So if you were really in a standalone practice where you wanted to know some of the formularies and things like that, that's what the paid portion offers. But again, you open up the app, you're signed in, you enter doxycycline, it comes up, you click on safety monitoring, and then in pregnancy, it turns out that it's a category D. So this would absolutely be a medication that I would not want her to be on, even though her friend has worked wonders for it. I think it's more important for her to have a safe ongoing pregnancy and delivery, so that would be something that we would need to think about other options. So thinking of, again, this through, as she then completes her pregnancy, she might come back in and say, now I've had the baby, I am breastfeeding, can I now take the doxycycline? And this then would kind of change your thinking a little bit, and so there's an app out there through the National Institute of Health called LactMed that you can download and plug in your information again to see if that medication is safe. So using the LactMed app, kind of going through, again, selecting doxycycline and going over to your summary, the overall sense through their reviews are that tetracyclines are contraindicating during breastfeeding because of possible staining of infants' dental enamel or bone deposition of tetracyclines. So again, they go in and have a close examination looking at, and they're reporting that there's not likely to be harm in short-term use. However, long-term use, which is what this patient would be kind of referring to, because it's not just a short acting of a medication. Usually when you treat it for acne, it's longer. Their recommendation would be not to use that. Kind of stemming back to before she has her delivery, she'd also be kind of wondering about what vaccines are recommended for her, which ones are contraindicated. And again, there are many different apps out there that can be used for this. The Society of Teacher of Family Medicine that I'm a member of, they end up having a very nice, it is a paid app, I believe it's around $5, that's updated to kind of look at what during her pregnancy, during childhood, during adulthood, what kind of shots should people be getting? And again, there's many different versions of these out there. Again, this is a moving target where I like having these types of applications because when there's an update, you know, clinically that happens, they go in and they change these. And so oftentimes they're ahead of, unfortunately, they're ahead of the insurance coverage, so sometimes where something's recommended that you want to give, but it hasn't been reimbursed by insurance and there's that lag, usually these applications are on top of it. So in this case, you know, kind of looking closely, varicella would be contraindicated in her. Getting zoster vaccine, which she wouldn't be due for anyway, is contraindicated. And the big one is the measles, mumps, and rubella. If she ends up coming up equivocal or in need of that, then that's something that you wouldn't want to give during her pregnancy. So that's not to be vaccinated during the pregnancy and kind of be closely followed thereafter postpartum for that. So again, these are nice reminders, nice ability to kind of look at that going forward as we look. And then just kind of stemming back real quick to looking at how many times a day do you all kind of use apps. And it looks like, you know, people are, you know, using them quite significantly. And, you know, there's only really a couple of you that don't ever use them, although there has been some that haven't answered in. But it seems like these are things that people on the call are frequently using, which is good to see because I think that they're not going anywhere. They're only going to become more and more prevalent in our daily work. Looking again at another case here, we have case number 3, and LK is a 41-year-old male who presents to an urgent care with aches in the wrists and ankles that won't go away. And the patient had a fever and rash 2 weeks ago. During the visit, he recently mentioned that he traveled to the Bahamas right before getting the fever and rash. So your questions that you have in your head are, you know, does the patient need to go for emergency care? What treatment is recommended for him? Which app would you use for this? And this is, you know, again, looking at a situation where a patient walks in with a skin manifestation, and it just so happens that VisualDx has a great builder with an application function, both, you know, on the desktop or your smartphone, that you can kind of plug in their symptoms, you know, plug in their findings and kind of look at what it is that's going on. And so in this particular case, it would appear as though this individual was exposed to chikungunya. I still struggle with that. And he, you know, it's obviously been kind of ongoing in tropical Caribbean locations around. And so at this point, I would kind of leave that up to you for management, but he made it back, so that's good. That's a good sign. Kind of looking forward about these, of course, you know, I think the case examples were ways in which we can kind of put the actual application to use, and there are many different scenarios. One can find it, to me, it doesn't just have to be primary care, it can be across all specialties that these are being used for. But I think the real important concept here is, how do we know if that app that we're using is trusted, is up to date, is evidence-based? And that, I think, comes with this caveat here, that there are multiple associations and academies out there that do have recommendations for apps on them. However, there can be at times where they have bias because they are being paid for by those businesses or have arrangements with them for sponsorships, et cetera. So that's just a caveat. And then there are some other health publishers out there like iMedical Apps and Mobile Health News that can kind of give updates on things. And one of the kind of standalone things that are coming up is the VA has its own app store now, where through the government, where they kind of recommend, as well as the National Library of Medicine, as well as some institutions might actually have their own app stores and et cetera. So those are things that are ongoing. There isn't a true quality company out there that kind of oversights all of these, but again, kind of looking at these, I think you can kind of get a sense of, where are they coming from? Are they standalone apps that have been made by one individual versus are they supported by others? And sometimes you can get an understanding of that. Then kind of looking over at the apps that we recommend for patients. This is kind of, again, the consumer side of it that's a big amount of these that I'm sure every person on the call has different apps that maybe they might recommend to patients after kind of going through reviews, and some of these examples that we'll go over are things like MyFitnessPal and OnTrack and MedCoach, but I'd be interested to know, what are, apps that your patients are using or that you're recommending to your patients as well. So with the growth of Apple products, it's pretty common now that lots of individuals are using Apple devices, and so just had to throw this slide in there because with the recent Apple update in their 9th version here, they do have on some of their higher level newer devices Health Kit and different wearables that people can use. And this is more consumer driven, but I imagine there is only going to be time before they end up being able to download it at your office, or you may very well now be reviewing them with your patients, but there are so many different opportunities out there, and this particular Health Kit is quite impressive with what it can do. So just to give you some examples of some of the things that you can do, you can figure out one's reproductive health by their basal body temperatures and know when they may be amenable to getting pregnant, with an ovulation tracker as well. There's opportunities to count your steps, monitor your heartbeat, other opportunities to kind of follow how satisfying your sleep is and how much sleep you're getting, as well as even tracking some of the foods that you eat as far as calorie intake and kind of liquid hydration. And a lot of these ongoing are, you can purchase add-ons to go with them, and even now they know when you're going up and down stairs versus being kind of flat on the ground. And you can communicate with other devices. There are many other devices that are out there right now. I'm sitting here wearing a Fitbit, and I try to get my steps in every day, just like everybody else that's kind of doing their best for their own health. But patients are going to come in, and they're going to want to know what are things that you recommend for them, and they also want to kind of know, what does this mean when I've had this kind of heartbeat that's been up. Another example is kind of MyFitnessPal. Again, these are ones that patients can kind of use as far as helping them with their lifestyle, setting goals for them, and kind of logging their intake, as well as an opportunity to kind of keep them honest by networking with their friends, and could also be something you're involved with your clinical team. So in conclusion, this is a very still vastly growing field of medicine, and it's being used, I'd say, more by patients still than clinicians, but there still, to me, is great potential for decreasing our healthcare costs as well as increasing our overall health by using this. But there still appears to be, because I think the Food and Drug Administration is overwhelmed, some lack of restriction or quality accountability that's looking over some of these. So just be careful with which ones you're using, unless it is a diagnostic app and then it is overseen. And I think as we kind of grow in more and as kind of the future continues, there will be some more organizational bodies that will kind of help make our decision making a little bit easier, that will be hopefully unbiased and kind of can track the safe apps that we should use when we're with our patients. Thanks a lot for sitting in on this today with us, and we look forward to hearing from you.
So thank you very much, Dr. Devine. I appreciate you taking the time for the discussion. We're going to open this up now. If you have any questions, please use the question and answer functionality in WebEx, or you can, again, send us a tweet at VisualDx. And we'll see here. Are there any questions that have come in thus far?
Somebody was just curious if we're going to have slides or a recording of the event afterward, and we will make that available. We'll post links on Twitter and Facebook.
Okay. I've got a question. Are there any particular chronic disease management apps that you use or recommend? And I think that, again, for chronic diseases, I'm thinking of, preventative services versus oversight of them. There's, again, another opportunity. It's a paid app would be, 5-minute clinical consult, DynaMed. You can obviously even see some of these stuffs on Diagnososaurus, and VisualDx has some of these as well. The AHRQ site, I really do like using that as well. Let's see.
Oh, and also for the patient.
For the patient. So I particularly don't have a favorite for the patient. I was hoping someone could tell me what patients are using. I practice in a urban residency practice, and so not a lot of my patients are coming in with smartphones that are capable of kind of tracking that. I'm happy that they show up. So anyone out there that has a really good patient one, I'd be happy to hear that. And the name of the app for the immunizations, again, is through the Society of Teachers of Family Medicine, so STFM is the name of that, and that has its own immunization tracker. And again, like I said, that's a paid one. It is updated by them. Once you pay that one flat fee down, you're okay to continue to use it. Also got another question about what do you believe are the best resources for residents and medical students for getting a basic background and understanding of a topic. So obviously it depends on the particular topic at hand, but again, circling back to one of my favorites, with DynaMed, they really circle back. The reason that I choose and say DynaMed over and over again is because they do literally update that site daily. So it really kind of gives you links to recent updated sources, and I encourage you to touch base with your residents and students because they are of a generation that can actually share best apps with us since they're kind of out there doing this work as well. And then I got another question of where do you see us going with the integration of apps to EHR, and I see that occurring. Again, there's this whole HIPAA concern, and so kind of crossing that walk safely without kind of disturbing people's privacy, I think, is quite important and will have to be kind of looked at. But wouldn't that be so nice if your patient came in to see you and their My Health app was just downloaded right to you to see right before you walked in the room? I think that'd be neat. So, and then the last one is we have, what about podcasts and any recommendations for clinicians? And YouTube channel has lots of podcasts ongoing. VisualDx has, of course you're on these now, but there are others out there. TED Talks, I think, are always a great one to look at. Lots of different venues of opening up and looking at. I think the sky's the limit as far as looking at some of those channels and topics, and you can usually find ones that are free and available, but of course there are some audio digest, other programs that require some subscriptions to be part of.
All right, excellent. Well, we are about at the end of our time here for our session. We've run a little bit over, but again, thank you everyone for participating. Thank you, Dr. Devine, for taking time today. And as the question came up, we will be converting this into a short video, and we'll post that on our YouTube channel. So go ahead, you can follow us on Facebook and Twitter, and we'll let everyone know once that video is up and available and ready. So thank you again, and keep on the lookout for the next of our clinical education series webinars. Thank you very much.